those are a little bit more subtle findings. Again, typically it's going to be easier to find them over here in your precordial leads. Another common finding with LVH is a biphasic P wave, which is indication of left atrial enlargement. Just makes sense that it's also associated with left-sided enlargement. And again, in this one, we also have left ventricular hypertrophy strain pattern, and that's likely the cause of these ST changes in V5 and V6. It's probably strain from the LVH, but again, comparing to an old EKG would be helpful to know if this is new or if this is old from the LVH. So next we'll talk about briefly is just atrial enlargement. So here we have a normal P wave, and when you have right atrial enlargement, you have a longer in duration P wave. It just takes up a little bit longer period of time, which makes sense. If the right atrium is a little bit bigger, it's going to create a little bit bigger waveform. And down here we have evidence of left atrial enlargement with a biphasic P wave here and here. That can look a little bit differently, but that's the left atrial enlargement. And that makes sense because the left atrium depolarizes a little bit after the right, and so the longer double-humped P wave would be left atrial enlargement.
Online EKG course at practicalems.com.